I think we can start.
I can start.
No, wait,
So before start,
my
first,
my clock is ringing actually. It's loud. The sound. Yes, Kavanish. You want to say something?
no, before you like start, just don't remind us. Then we will mute our microphone.
Okay, okay. Okay, can everyone see my slide?
Yeah.
Yes.
Okay.
So I mute now.
Yeah, sure you can. Okay. Okay, Kavanish, turn off your microphone. Okay, I'm going to start. Okay. Um, Hello, everyone. We are from Organization Counseling class, section 01G. Today, we are going to present about anorexia. Before I present my part, I would like to introduce myself and my group members. My name is Achu, and my group members are Nur Faradiana, Tung Sweet Yan, and Kaminis Rao. And now I'm going to present about the introduction of this topic, which is what is anorexia and the symptoms. So, what is anorexia? Anorexia is a psychological and potentially life-threatening eating disorder. For those who suffering from this eating disorder are typically suffering from an extremely low body weight relative to their height and body type. This particular eating disorder will lead to self-starvation and lack of appetite. So the next slide is about the types of anorexia. So there are two types of anorexia, which is purge and restrictive. Purge is when people struggling with this type of eating disorder will always purge after eating, like avoiding the food. The second one is restrictive, is when people limit the quantity of the food, calories, and always high fat or high sugar foods. So the next slide is about symptoms. Um, Now there are a lot of things if we talk about the symptoms, but I just took the main four symptoms. So the first one is chronic restrictive eating or dieting beyond the norm. The second one is rapidly losing weight or being significantly underweight. The third one is loose or thinning of hair. And the final one is the sensation of feeling cold, particularly in extremities. So that's all from me. Now the next slide will be presented by my group members. Thank you.
Assalamualaikum and hello to madam. I'm Nur Farah Diana binti Azad. My matric ID would be CB17087. Now I'll be presenting about the availabilities treatment in Malaysia for eating disorder, which is anorexia. So there are three treatments are available in Malaysia. First is medical treatment, dietary treatment, and psychology, psychotherapy or counseling. So in medical treatment, they will first the doctor will monitor the organ function because when someone facing this disorder, the major organs like heart, livers will be probably damaged because of the gastric juice. Besides that, there will be lack of minerals and vitamins in this particular persons who facing this disorder. And also the doctor will look after the patient so that they're not facing any depression. They will give this antidepressant so that these patients are not in the mode of very extreme depression. Next would be dietary treatment. Dietary treatment where the these people will be guided in a proper way of getting their minerals to increase their body weight. Besides that, they will also promote a very good food diet in order to gain weight faster. Some dietary treatments are should be forced to be feeding in necessary for the patients whom is serious underweight and refuse to eat. Next would be the counseling treatment. Sorry. Next would be the counseling treatment. In counseling treatment, the patient will be get help to increase the strength of their self-esteem and also clear the burden psychology burdens. Some people who facing this anorexia are most probably in a psychological problem, so they will be given a proper counseling to relieve themselves from this burden. Next would be the general cause to have eating disorder. There are three general cause which cause this eating disorder. First is the psychology factor, second will be genetic predisposition, and third will be the environmental factor. Psychology factor will be the general cause because a high level of perfectionism, feeling limited control in life and low esteem, and the tendency towards depression and anxiety. The genetic predisposition would be gene inherited from the parents, and anorexia nervosa often runs in the families. Most probably, those people who facing this anorexia are highly chances of the genetic predisposition where they inherit the gene of their mother or father or maybe the both of them, which cause them to be so thin. And next will be the environmental factor. The environmental factor is the onset of puberty, stressful life events, and relationship problems. Most of people who face these environmental factors are are facing this problem because of the lifestyle which the society put into them. Next would be the cause of eating disorder based on age. If you see properly, in the age of 14 to 25 years old, the cause of eating disorder are social isolation and family conflicts. And besides that, possible having traumatic experience on their life, on their childhood. Usually people who face this eating disorder will have this kind of problem in the younger age of 14 to 25 years old. And the people who's 25 years and above will probably face society pressure on on the phrase, only if you are thin you will look beautiful. And mental disorder like anxiety and depression will cause them to have this eating disorder. Next, I will pass to my friend Eng to present.
Okay. Hello, madam and my friend. My name is Eng Sui Yan with the metric numbers CB18146. Now, my topic is how would you help those in anorexia? You know from my other member, you will know the anorexia is because of their low esteem or not happy with their body size, so they are become anorexia. So there are 5 steps you can do for the people who suffer in anorexia. First one, you need to pick a good time. You need to try to speak to a person which is suffering anorexia in a private place, because this is a conversation at the time emotional calm, because when you talk privately with the person, that the private place will don't have any people interrupt. And then the second step, you can explain why you are concerned. Sometimes you need to know your goal point at this point is not to offer solution. You need to tell the person who suffer in anorexia why you concerned about that problem, why you and you need to tell you concern because of the person health, not because you want to um angry the person who don't eat anything. And then the one to prepare for denial and resistance. Sometimes the people who suffer in anorexia will not admit they are and in a they are not admit they are in a problem of anorexia. So you need to remain calm, focused and respectful, and then don't take it personally. The meaning of don't take it personally means that you don't you cannot angry if the person in suffer in anorexia don't admit uh don't admit the problem having by the person. And then the the fourth fourth yeah, I need to move a bit. Okay, the fourth step is ask if the person has a reason for wanting to change. After the person who admit they are in a problem suffering in anorexia, you need to make them may want to change for other reason. Maybe they want them to change because of healthy, because of you are because of the people who loving them, who caring about them, don't let them suffering anorexia. The most important, they're willing to start to seek for help. And then the last one is be patient and supportive. You need to take some time before they're willing to open up and admit to have a problem. You need to listen without judgment. You cannot judge them. You need to eat more. And then this is because I caring of you in a mood of very angry or something. They will become they don't want to don't not willing to admit their problem. And then the next topic I want to talk is how would this information help you to be a better managers or workplace counselor. The first one is ability to listen. You will know how to listen without judgment or evaluation. A counselor also need to be able to listen between the lines. Um, this means that we need to listen what happened and calmly for the people who suffering for some problem. You need to understand your client. You need to understand your client problem without any anger. If you anger, the individual behavior will become a challenging when they feel treated, undervalued, or being judged. And then the third one is be knowledgeable. Knowing is not enough. we must apply. Willing is not limit. We must do. This is a sentence tell by a person who named with Johann Wolfgang Goethe. Okay, we need, because we need to apply this sentence, because sometimes counselor need to deal with variety of client situation, so they need to be knowledgeable to any situation. The fourth one is accessibility and authenticity. You need to gain client trust, and developing in empathetic connection with each client is key to moving forward in the therapeutic process. You need to know when the client is not believe on you, they will not try to tell you all the truth or about their problem. So you need to, when you do some conversation with your client, you need to gain the client trust. And then the next, I will pass my presentation to my next member. Thank you. Okay.
All right, so I'm going to talk about what are the association in Malaysia that deal with this type of challenges and illness. So basically, they have gone a lot of categories. So what I did was I chose the major categories. So there were two categories. One is children, another one is teenagers. So for children as young as 11 years old is suffering from this illness. Without a proper health guidance provided by their parents, lead to severe complications. Emotional issues also a threat. So what we're going to try to tell in this slide is, okay, most children, sometimes they are self-claim that they are thin. They remember maybe they born thin. So they want to some parents, they won't care so much. So some parents won't take it as something to care so much. So what they will do, they will discourage them. They will not take an issue. And these people, when they go through to emotional state, so they will become threat for them. So secondly, for teenagers going through social pressures can be lead to anorexia. Teenagers who have low confidence and low esteem. So basically, for example, like social pressure, like as my group member told me just now. So for this one, I would like to take example for teenagers, especially girls. So girls, what they'll do, they will post, normally they will post a picture in Instagram. So when they post a picture in Instagram, sometimes they will get the feedbacks, like sometimes bad feedback, like criticism, like telling the girl is too fat and telling them ugly. So when they label them as ugly, they can make they are so demotivated, they become demotivated and they have no low confidence. There will be a low confidence and low esteem. So these will lead to anorexia. So for the next slide is the conclusion. So conclusion, it's better for us to identify the eating disorder on someone as early as possible, so that we can prevent it to become more worse. So we can get a good chances of getting good results is much more higher. Secondly, better to consult a doctor immediately if the anorexia illness become more worse. So these are the two steps actually we can take. So always seek for help. So as a counselor, it is important to identify this disorder and provide prompt management. Also seek for counselor assistance. If this illness is very difficult, it can't maybe the person can't move on from this sickness. So what they can do is they always can consult and counselor. Second, create awareness. So campaigns should be conducted in workplace and schools. Why schools? Because schools, mostly teenagers, actually this illness only mostly affected by the teenagers. So what they can do, they can provide campaign on the schools and also workplace. So advertisement about anorexia awareness should be aired on social media and television. Okay, this particular point actually I need to highlight because mostly anorexia, maybe some people might know. I think mostly 70% people don't know actually. So what they can do is, without concerning the commercial profit, so we can be socially, maybe we can volunteer by doing advertisement. we can spread more awareness through our television or social media, because we are living in a technology era. So thirdly, prevention steps should educate to parents. Why parents? Because parents are very important. Parents are important, playing a vital role to children, so that the children won't get like this kind of eating disorders. So next one is spread positive messages. So avoid commenting on appearance. Second one, try to help the victim to build their self-esteem. If the person, if for example, if the person is fat, try to motivate them. Try to tell, okay, I know you are fat, but you are fat. Maybe you can give a statement that you are fat, but you are beautiful in and outside, something like that. So second one, always check with your family. Check on with your family. Always help them to identify the negative thoughts that are running on their mind. So basically, some children, they don't prefer to share it to our parents, so mostly teenagers, because we know their mindset, our mindset different. So what we will do, we won't share. So as like our brothers and sisters, if we have brothers and sisters, it's better for them, like maybe they also have our same wavelength, same mindset, so better for them to identify as soon as possible this eating is something negative thoughts that being maybe disturbing to them. They might lead to anorexia illness. So I request them maybe to identify, maybe try to talk with them or seek help with them, seek assistance, maybe try to spend time with them. So I think that's all from me and my group. Thank you.